Welcome to the River City Hardball Podcast. I'm your host, Andrew Gibson. It's always a pleasure to welcome in our friend Jacob Evanich from Optimized Physical Therapy and Sports Performance. We talk sports injuries related to baseball here on River City Hardball. Man, good evening. How are you?
I'm doing great, Gibby. It's been a good day. Glad to be back on here after a week break and get after it. It's going to be a fun topic tonight.
We're going to talk about thoracic outlet syndrome, and we're going to get to that in just a moment. But first of all, you and I are squaring off in week one in fantasy football, man.
Yes, sir.
What are your early thoughts on that week one matchup?
Oh, man, I'm taking you down, man. I don't care what the projections say. Projections might be on your side, but that only goes so far. We'll see what actually happens Sunday.
Yeah, one of the leagues I was in a few years ago projected me to finish last, and I won the league. So you never know,
I hope that's me, because we were talking right before this, and I'm ranked 11 out of 12 in the preseason poll. So I'm hoping that's me.
Yeah, projections, whatever, man.
Yeah.
But fantasy football, it's that time of year where football and baseball kind of intersect for all of us, and it's a fun time of year for sure. Let's talk about what you just mentioned. What is thoracic outlet syndrome? What is that?
Yeah, so it's what we call like a neurovascular issue. So it ends up being where either the nerves going down the arm or some of the vasculature with your veins or your arteries end up getting affected, and then it just ends up affecting your whole arm, your throwing arm, in different ways. So it can really throw off pitching and throwing performance. And we'll delve in a little bit more on the specifics of that. But yeah, it's a nerve and a vascular issue. So it's a little bit of a different kind of injury than what we typically talk about.
What is the nature of that injury? How does it happen? What are the signs maybe you look for with that?
Yeah, so it can happen for a number of reasons. So just over time, throwing repetitively over and over again. If it's the nerve issue is the most common, where there's a stretching or a rubbing of the nerve in a certain area. The veins getting affected are the second most common, and the arteries are the third most. So you're looking at like 80 to 85% are actually the nerve issues. So that's what we typically end up seeing in at least in the pro baseball players who have had it, is more the nerve problem. It can happen because genetics, where you end up having sometimes an extra rib in your neck area. So that decreases the space, because there's already a very limited space where those nerves and all the vasculature end up running down the arm. So that can lead to it. Over time, just some of the neck muscles called your scalenes can get really a little bit bigger and kind of spasm, and that can compress the nerve. Our one of our pec muscles can get a little bit tight. So if we have any kind of like also just scarring of anything in that general area where those nerves run, anything that compresses the nerves and the vasculature going down the arm or consistently rubs up against that, that's how it ends up developing. And especially with pitching, it's such a repetitive movement, as we know. So that can kind of develop over time.
I've seen some of the symptoms are like numbness and tingling. Is that right?
Yeah, numbness and tingling is one of the big ones. Any kind of paresthesia going down the arm. So that's what we really look for. And I think it's something that's good to be aware of, just because even if you're just having a little bit of, you might not even really have those symptoms. You might just all of a sudden realize that you're kind of losing command, or your arm just feels a little bit fatigued or heavy, and you don't really know why. But that's one thing we need to keep in mind. It is relatively tough to kind of diagnose. We have a couple of tests we try to do to check the vasculature in the arm, and we have tests where we can see if the nerves are involved. But a lot of times you're not having symptoms until you're actually throwing, when your body's really having to go through that violent pitching motion like we talk about. So when you're at rest, you're completely fine. It's just when you're throwing that you might be having those symptoms. So a lot of times it's more of a diagnosis by exclusion, where we try to figure out, okay, are these other muscles or tendons involved? And then gradually we end up getting to figuring out that it's probably the thoracic outlet syndrome, unless it's something that's a severe case where, like the vasculature, you'll have where you just notice that the blood isn't really going down to your hand as well. So you might have like what we call like blanching of the skin, where it just looks a little bit more pale. or you might start getting one of the symptoms is getting blood clots in the arm. So that's when you really know that this stuff is for sure going on. And those symptoms are a little bit more obvious, like with the veins, more swelling in the arm and redness. And then with the arteries, a lot of times it'll be just decreased blood flow down the arm and some of the clotting.
Some of the recent examples that we've seen when we're talking about Major League Baseball with thoracic outlet syndrome, Matt Harvey, I believe, had it, Adam Wainwright. There's been some pretty high-profile guys that have had this, right?
Yep. Yeah, absolutely. So a lot of those guys have had those, what we were talking about, those nerve symptoms going down the arm, so the numbness and tingling and everything going into their hand. And that just makes it really tough to really feel the baseball, even feel your release point. So we don't really think about those fine little motor tasks that we have to do to throw a baseball. But if those little things are off and you don't really know where your hand is, your brain can't perceive completely where your hand is in space when you're releasing that ball, that can really throw off your command. A lot of times what they end up doing, so a lot of times they'll try rehab first, and they'll see, if the scaling muscles go from your neck down to some of your first rib. So that's one of those areas where all the nerves go through. They actually go through the muscles there. They also go through an area where your pec minor muscle ends up going over the nerves, and it kind of gets wedged in between some of the bones there. Also, what we call your subscapularis, which is one of your rotator cuff muscles. So we try to see if maybe the muscles are the issue. So we'll do some physical therapy for that to loosen up the muscles and calm down any spasm. If that doesn't really work, and if they notice when they do some imaging, if there is a little bit of compression with, say, your rib, your first rib, or if you do have an extra rib genetically, then they'll remove the first rib. I know Matt Harvey, he was one where they just removed the first rib. I'm not sure exactly what they did with Wainwright, or they might release some of the scaling muscles to free up some space, or they might release that pec muscle a little bit lower to free up space so everything can run a little bit smoother.
When you have what's often referred to as TOS, thoracic outlet syndrome, I mean, are you able to pitch with that? It seems like that would be impossible. Like if you have numbness down your arm, doesn't that seem like an impossibility to throw a ball effectively?
Yeah, once again, it depends on severity. So sometimes it's just really kind of light where, some guys, you'll start having that numbness and tingling. You're like, okay, there's something definitely going on here. Or some of the major vascular issues. And it's like, okay, let's immediately get checked out. Something's going on. Other guys, like I was saying, you can throw, you're just feeling a little bit more fatigued in your arm as you're throwing. So it doesn't seem like anything major, just kind of typically what you might deal with from time to time. But it affects performance. So, it depends on the severity is the big thing with that. What we were talking about too, in the past, we've talked about dead arm syndrome. You've asked about that. And we kind of talked about the muscle fatigue being a major part of it, where the rotator cuff is really fatigued. Nerves go to the muscle and cause the muscle to fire. So if you have something like this going on also, you could have a dead arm syndrome kind of coming up where it seems like it's just more that arm fatigue, but it's actually more the nerves are the issue and thoracic outlet is the issue.
Is there anything that causes this more than anything else? Like, I know we've talked about a repetitive motion of throwing, but all pitchers do that. But is it certain things that happen that cause TOS like that?
So sometimes the increased size of the muscles over time, or increased spasm of the muscles, or just over time, some of our tissues in those areas can kind of thicken, and it closes off that space a little bit. So a lot of it's kind of that repetitive motion over and over again that can close up the space just in different ways with the tissues and what have you. You might not have it, when you're younger, but as you keep throwing more and more over time, then those things kind of develop.
If somebody develops thoracic outlet syndrome, what should they do? Should they immediately try to rehab? What would be the course of action for that?
Yeah, so it definitely depends on the symptoms, because that's why this is kind of a tricky one. So if it's always, for sure, go to any sports medicine professional in your area, especially like a baseball orthopedic doctor would be a great one to go to make sure they can do the imaging to see maybe if some of the space is closed off. With it, they can do MRI if they think vasculature is involved. They can do different studies or imaging where they end up seeing how the blood is flowing through the veins or how it's flowing through the arteries. And you can see if maybe there's an area that's kind of pinched off, because that's what ends up happening with this is, especially with the veins, it's actually the most common vascular disorder in youth athletes is the what they call, it's a long name, but axillary subclavian vein effort thrombosis is what it's called. But all that means is those veins in that area, they end up developing a clot over time. So the rubbing of that vein, it can cause like a fibrosis of the vein, so it closes off the blood flow through the vein. And then you can still not have symptoms because you have other vascular, other veins kind of branch off around it that make the symptoms not really occur. But then you can get a clot as the long-term result of it. And that's the most common thing for youth kids. It's more of like a genetic anatomy kind of issue where you just have that rubbing of the vein over and over again. So that's when they might have more like the redness, swelling. The veins might be really popping out in their arm. That's when you're thinking that kind of the venous thoracic outlet syndrome. So yeah, it just depends on the symptoms. If you think you have it, definitely go to your doctor, orthopedic doctor, as soon as possible. If you're just having symptoms of, you're having a little bit of numbness, tingling down your arm, that can be a lot of things. That can be just other nerves coming out of your neck. It could be a neck issue. It could be the thoracic outlet, but that's not that common. So like I was saying, we can kind of decipher out and say for sure you don't have certain pathologies, and then we might get led towards, okay, it seems like it's thoracic outlet, especially if you're having it while you're throwing and not really at other times. So like me, I would be able to tell pretty well if maybe we need to work on your scalenes or your pec or things like that. If it is like if I'm seeing signs of the arteries being an issue, then that's when I would refer out immediately. If we were working on it for a little bit and there was no improvement, because if it's minor symptoms, that's what your orthopedic doctor would most likely end up telling you anyways, just to have some physical therapy and see if we can kind of improve it. But if there was no improvement over a certain period of time, then that's when for sure we'd refer back, and they would see if there was other options where they could do like the surgical route or something.
Thoracic outlet syndrome sounds like a very scary diagnosis, but
it does, yeah.
In a sense, I mean, some people might think it's a career ender, but you look at some of the examples that we've talked about. Adam Wainwright's pitching into his 40s at a high level still in Major League Baseball. Matt Harvey's having a pretty big resurgence. Now, he's not the pitcher he was, but that doesn't mean that it contributed to what he had there. But it may just be his stuff, just not as good as it once was. But
yeah,
it's right. It's not necessarily a career ender like it might seem.
No, definitely not. But I think it's come to the limelight a little bit more in sports medicine in the last decade or so. So the surgeries are somewhat still relatively new. We do have certain surgeons throughout the country that are really well known for dealing with this, for like the MLB guys and everything. But some of the stats that they end up having, there's not a huge sample size, but about 75% of guys will get back to playing baseball again, which in medical terms, that's actually a pretty low number, 3 out of 4. We would like that to be higher, into the 90s and high 90s percentile. Also, there's about 1 in 3 end up having to have a second procedure done for something like this. So it is relatively tough to come back. I mean, it takes about a year on average to come back to throwing and everything. So it just takes time, because when the nerve, how we had talked about how the nerve is the usual suspect that ends up getting affected with this. Nerves take a long time to heal back up. So that's why it takes so long to end up coming back to the throwing, and you just hope that nerve can really heal back to its prior function.
Fascinating topic tonight, thoracic outlet syndrome, very interesting stuff. As we wrap up, catch me up on what's going on with you, Optimized Physical Therapy, Sports Performance. How are things going?
Yeah, everything's going well. So it's been fun. We have a mix of things we're kind of doing right now. So some people just really want the strength training and get strong during this period of time. I always emphasize that the fall really, I know there's a lot of fall ball around here and a lot of fall ball tournaments and showcases. But now's really the time, if any, to really prepare your body. You think about the pros. I mean, after September, October, they're off. They have their couple months to really rehab and everything. So they're taking their full 4 months plus off to strength train and all that kind of thing and get their bodies right. So this is really the time with the high school season coming up in January, February to really get your body right, make sure it's moving well, get really strong. I mean, if you tell me that any high school kid, if they work out, 2-3 times a week with some decent lifting for 3 months straight, that they're not going to get better, I'll call you a liar. I mean, that can be a huge game changer. Strength is the biggest cheat code, especially when you're in high school, because not everybody is as strong and trains appropriately to get as strong as possible. So we have a lot of people doing that right now. Also, some other guys are coming to me for a little bit more like the speed training, agility training to improve that. And then there are also people who are injured and a little bit banged up at this point. So they're just coming more for the physical therapy and trying to get them back to the full health and get rid of their pain.
As the weeks and months get closer to baseball season for high school, we will certainly be referring you to Jacob Evanich, Optimized Physical Therapy and Sports Performance. We want to get those guys and girls in there to get their work done for baseball or softball here in the Jacksonville area. Great stuff, man, as always. We appreciate the time. Check them out, optimizedptsport.com on Instagram and, of course, online as well, and Facebook too, right?
Yep, Facebook as well. You can find our page on there. And you can get in contact with us through any of those means.
Great stuff. We'll do it again next week. Thanks, man.
All right. Thanks, Gibby.